My name is Aiasha, and I am a social worker in the Charleston region. We're not just your ordinary healthcare practice. We actually care about how you are able to get to doctor's appointments. Have you eaten today? Have you been able to check on friends? Have your friends been able to check on you? Did you go outside today? Whenever a patient does get a phone call from a social worker, they automatically are nervous because they're wondering, why is a social worker calling them? And they automatically think, okay, am I doing something wrong? But I immediately let them know that I've received a referral from one of your providers, and I'm just here to make sure your well-being is okay, make sure you have everything you need. I let them know that I am an advocate for them, that I'm a listening ear. Here's my number. You can text me or call me at any time. And I make sure that they hear that because I want them to know I care about others. I care about if someone has eaten food today. I care about if someone was able to have a shoulder to lean on and cry. I care about if someone's having a rough day and they're just wanting to vent. I also want to be an advocate for people who just lost their voice or are afraid to say things. I want to be that person for them, and I want to help.